It's time to go beyond the headlines, cause I don't put in overtime just so I can headline. Okay, now it's Fox Sports, I'm live with Renee. Going hard every day, sports rapping every play. Different segments for your favorites, coming at you daily with positive vibes. Yeah, we some game changers. Basketball, football, soccer, with different interviews. You never know who may pop up. Listen, only on Beyond the Headlines. This is Beyond the Headlines. Only on Beyond the Headlines. This is Beyond the Headlines. Only on Beyond the Headlines. This is Beyond the Headlines with Renee Washington.
It is time for our positive vibes only segment here on Beyond the Headlines with Renee Washington. And joining us from Mississippi, just outside of Jackson, Mississippi, we've got Dr. Michael Jones. Dr. Jones, welcome to the show.
Hello, I'm glad to be here.
Well, I'm happy to have you here, especially after seeing your recent announcement that you became the first African-American male to ever get through the PhD nursing program at Hampton University, just the third to defend a dissertation, to become Dr. Jones. That's incredible. Congratulations on that.
Thank you so much. I am truly humbled by that accomplishment.
Can you tell us how long it's taken you to get through this process? I mean, the medical field is not an easy one by any stretch of the imagination. So I'm always curious to hear the story behind it and the journey behind, how many years in the making has this been for you to be able to now officially say you are Dr. Michael Jones?
Well, I actually became a nurse back in 2000. I always wanted to be in a profession to where I could actually help people. It was actually going to be either a registered nurse or I wanted to be an English teacher, believe it or not. So I was successful in nursing school. And I always said that if I were not successful in nursing school, I would be an English teacher. But thankfully, I was successful. And my grandmother had always wanted me to become a doctor. And at that time, I knew it was kind of out of the question for me becoming a medical doctor. So I decided I'd give her the other kind of doctor. So I became a registered nurse in 2000. I've worked in various capacities over the years, and in June will make 20 years. So in 2010, I decided that I wanted to further my education to, get a doctorate in the nursing field so that I could teach, and also I love research. It has taken me a little bit of time because obviously it is 2020 now, but I've suffered some losses, including the death of my father, had some illness.
I'm sorry to hear that.
Oh, yeah. Some other things happened, so that did kind of, set me back a little bit, but thankfully, March 25th, 2020, I defended my dissertation. So I've worked in various capacities in the nursing field. Started out as an orthopedic nurse back in 2000, and then later I became a spinal cord injury rehab nurse. Got burned out at bedside, and I've done some work in the public and private sector of healthcare. So that's kind of my journey to the PhD.
Wow. And one thing that stands out about what you just discussed is how over the course of, your journey, starting back in 2000, it was steps. There were steps that were involved. So first you became a registered nurse, and then you made the decision to further your education in 2010. But also the key part of that, since 2010 to March 25th of 2020, when you officially defended your dissertation, you talk about the setbacks and the moments in life where you had to, put your family first, or, put whatever, dealing with the passing of a loved one, things like that we don't plan for, that in that moment, you had to take a step back from what you were pursuing to focus on that. And I think that's something that as we deal with the coronavirus, which is a huge setback, and just in life in general, we're always thrown these loopholes. You never know when someone's going to pass away or get sick, or you're going to lose a job, or a pandemic's going to happen. You don't plan for those things, yet it's going to happen. And it took you 10 years specifically focus on getting your PhD to get to this moment with those setbacks.
Right. And an important thing for me is to never lose focus. Those setbacks in life will happen. And I mentor young individuals who are coming up in nursing and healthcare in general. And one of the things that I let them know is going into it, you always expect to have some type of setback. You always want to allow yourself time. But the thing that you must not do is it's okay to be knocked down, but it's not okay to be knocked out. And I always
Mm.
tell them to take those losses, shake yourself off, learn from them, and then take what you've learned from those losses and move forward. And that's exactly what I did while working towards this PhD, which was again a 10-year journey.
Yeah. Oh, I love that. It's okay to be knocked down, but not knocked out.
Exactly.
That's a great message because you are going to have moments that kind of set you back in a sense that or make you have to take a step back and realize that there you have to focus your energy maybe temporarily somewhere else on your
Right.
family, on your health, whatever it may be, but you can't let it completely stop you from your
Exactly.
journey.
Exactly.
So as you talk about the influence of your family getting into the medical field altogether, how has being um in this role as a registered nurse, as a teacher, as now having your PhD, how has that really helped you to impact others as you talk about being a mentor and someone that's now also teaching and leading and guiding others in their journey?
Well, for me, and especially being an African American male, there's very few of us in nursing already. There's very few of us in leadership in healthcare. So I look at it as an opportunity for me to reach back and bring others forward. There were individuals in my life, especially in my early career. I actually started out with an associate degree from a community college as a registered nurse. And there were individuals who took interest in me, took the time out to mentor me, to kind of steer me in the right direction. And I've had mentors all throughout my career, 20-year career as a registered nurse and in healthcare administration, that have taken the time out to help to shape and mold me. And that's one of the things that I've tried to do over my 20 years in healthcare and nursing, is to be that change agent to bring others um, along with me, because I know it's much needed in our society today.
I'm glad you bring up the discussion of mentors because as someone that's now getting into I would like to say the middle part of my career, something that I've been seeing in specifically the broadcasting field, but I'm curious to know if your thoughts and take on this in the medical field is that, there's a lot of misconception as to what a mentor is supposed to do for you and how networking and connecting with others is supposed to help your career. And I know I've actually had people that reach out to me like, I see you work with Fox Sports or ESPN. Can you get me a job? And I'm like, first of all, I don't even know you. And that's definitely not what I was brought up thinking that mentors are supposed to help you do. The point of networking and having someone to guide you is to give you advice and to help you through any struggles or adversity that you face, to talk you through things, to provide feedback, but not to just give you a handout. So I'm curious to know for you and your role as a mentor, specifically in the medical field, what is your advice to those looking for mentors, the mentees, and the best way to take advantage of the relationship you build with a mentor so that it's not that you're looking for a handout, but that it's a mutually beneficial relationship where you're working together, where you're building together, learning from each other, having conversations to help pursue your goals.
Right. I like to think of, I'm a country boy here in Mississippi, so we fish a lot. And I look at a mentor as not someone who brings the fish to you, but someone that shows you how to go out.
Mm, yes.
So that mentor should be that individual that helps to give you the knowledge, helps to give you the tools, helps to make you give you those connections that you need in health in healthcare or whatever whatever area you're in. Not so much that person's going to give you a job, but that individual is going to show you how to get the job. And what individuals should look for in a mentor. I always tell my people, individuals that I teach for an HBCU here in Jackson, Mississippi, and a lot of things that I tell my students: seek out someone who's in a position where you see yourself in the next 10, 15 years. It really does not make sense to find someone who's not even working in an area that you could see yourself working in. spend time with that individual. Make sure that that individual is someone who's approachable. That individual needs to be someone who knows how to, as I stated, teach you how to fish instead of just giving you the fish. It should be someone who has a very positive reputation in that community. And the most important thing, and I have to keep saying this again, it needs to be someone that you could see yourself filling that person's role when he or she exits the scene from whatever sector they're in, be it healthcare, be it um, uh, journalism, whatever area that person is in.
Yeah, I like that. I love that concept of they're not supposed to just give you the fish, but help you learn how to fish, and also someone that's in a role that you aspire to work in. So, with you being in healthcare and with the pandemic going on, that is literally flipping our world upside down, I do, of course, have to get into your thoughts, takeaways, things that you've been seeing on the medical side around the coronavirus, and just you know there's a lot of uncertainty, and of course by the time this interview even airs, I'm sure there will be completely new numbers, completely new insight and direction as to what we're going into as a world, more than just as a country. But I mean, your thoughts on the spread of this, and if it's something that is, as you're working behind the scenes, I don't know, how sustainable do you believe this is as we get into the summer months? A lot of discussion has been that in the summer viruses are less likely to be able to spread and survive in the humidity and the heat. But we don't know much about the coronavirus, enough to know if COVID-19 is different in that aspect. But just curious on your medical thoughts as a medical professional, me being not one at all, around COVID-19.
Yeah, COVID-19 has really brought to bear everything that I've learned in healthcare and nursing, especially in public health. And I was thinking, as a teacher, I was thinking that the times that we're living in now is going to be written in a textbook for future students because we're learning. Researchers are actually finding new things out about COVID-19. And what is going on today will actually help to educate future generations. Myself, I just celebrated my 43rd birthday on March 13th, and I've never seen anything like this in my lifetime. And I think going forward with the issue of COVID-19, not only should we learn about COVID-19 to prevent a pandemic going forward, but I think it's very important right here and now that communities, that people in the communities, that our leaders do everything absolutely possible to stop the chain of spread of this particular condition. I read this morning that Dr. Fauci is saying that there is some glimmer of hope with all of the mandated social distancing. So hopefully, I'm optimistic that as time goes by, that we can see um, some tapering off of this disease. But I think the most important thing is that we as communities have to heed the warnings of the Centers for Disease Control and Prevention, for example, and our city leaders when, there are some cities that have implemented curfews, have implemented stay-at-home mandates, and it's very important that individuals take those things serious. I was kind of riding around this weekend, I saw individuals kind of walking around, just like nothing was going on, and it just kind of disheartened me because I was thinking, that person standing on the street corner, those individuals who are in large crowd gatherings, could very well be our next case of coronavirus, or could indeed be our next death. So it's going to be very important that we take what our leaders are telling us to do, learn from what science has said, and we should see this kind of take care of itself going forward.
Yeah, that's the biggest thing is we have to be, more vigilant and proactive. We have to listen. We have to understand the severity of this virus and not take it lightly, which unfortunately a lot of people have done, which has led to the numbers
Yes,
increasing so much. So I'm
yes.
curious to know, how has COVID-19 affected your work? I know for a lot of us, because we aren't in the medical field, it's has us working from home. It has us changing our, our daily routine in that aspect. But for you, it's being in the medical field, it's probably increased, and I don't want to speak for you, but increased your roles because now you're working even more tirelessly to help others, and maybe your patients are increasing and things like that. So I'm curious to know what you've been seeing from your perspective in your job.
Well, for me, I've been a teacher in healthcare for the last 10 years. And my primary role now, I have not actually practiced nursing per se at the bedside for quite a while, but I do serve the role of educating communities. So my role is utilizing every platform that I can to educate communities about the seriousness of this condition. And it ranges from, teaching individuals how to cope during times where we're kind of quarantined and stuck at home, to also getting people to just do the simple thing of staying at home, um, teaching basics of washing hands, teaching individuals how often to wash their bathroom down, for example, how often to wash their kitchen down. So for me, it's more so from an educational perspective. I do a lot of posting on LinkedIn, as well as Facebook and Instagram, to really get that word out there about the seriousness of this condition. And actually, I kind of felt bad a little while because, Governor Andrew Cuomo was asking for nurses to come to New York. But, I've been out of practice for so long, I just didn't feel like, I was equipped to go there. But it did dawn on me that I can help.
Mm-hmm.
So I have donated, to that cause, and also I've taken upon myself to serve as that educator, not only for my family but for the community at large, about the seriousness of this disease. Because as you stated, individuals are really, it just disheartens me that this is a serious pandemic. This is the silent killer, as some individuals have, or silent enemy, as some individuals have termed it, and they're just not taking it serious. And for me, as a registered nurse and an educator, I feel like it was incumbent upon me to use my knowledge and skills to get out there and educate communities about this condition. And I think that too will help to get individuals more in tune, and also help individuals to see the seriousness of this condition so that we can begin to flatten the curve.
Mm-hmm. Yeah, that's a good point. I mean, it definitely has been something that has changed, the way, as you talk about the conversations that you're having to educate, to spread awareness, on all fronts. I mean, of course, I'm not directly involved, but everyone in some way is working to help change this, and help us get past this. So, Dr. Jones, thank you so much for joining the show. Where can our listeners follow along with you in the work that you're doing to educate, to teach others how to, whether it's through coronavirus or just in the work that you're doing in the medical field? Where can our listeners follow along with all that you're doing?
Okay, I'm actually very active on Instagram. My username is Michael J4551. I'm on LinkedIn. I am Michael L. Jones. On LinkedIn, I'm also Michael L. Jones on Facebook. I have also a very small LLC, a little consulting company. It's called Jones Healthcare Solutions. I have a ton of educational materials on my website. It is joneshealthcaresolutions.com. That's joneshealthcaresolutions.com. I can also be reached, if anyone has any questions for me, at Michael J4551 at AOL.com. That is my email address. So either one of those
Perfect.
areas, I can be reached at.
Perfect. Thank you. Thank you so much, Dr. Jones, for joining our Positive Vibes Only segment this week. It's been a pleasure having you on. And I hope that anyone interested does check you out on Instagram at MichaelJ4551 and email you, or check out your website too. So it's been a pleasure having you here, and I wish you all the best and nothing but good
Thank,
health and safety at this time.
thank you so much.